Good morning, Mr. Singh, and how are you this morning?
Not too bad.
Okay, I've just had the handover from the nurses, been telling me all about you. So I just want to know if you've got any pain or anything.
I've had a few changes in my stomach and I've tried to drink plenty of water, but I'm finding it difficult.
Okay, all right. Well, what I'm just going to do is I'm just going to check your observations to make sure that they're okay. But I just need to check first that we've got the right patient. Is that okay? So can I have your wristband, please? Can you tell me your name?
Shoshi Singh,
Okay, and your date of birth?
23rd of July 1953.
That's lovely. Okay. Okay, I'm just going to put this on your arm, like before. Okay, and touch you up. I'm just going to pop this on your finger, okay? Right, I'm going to turn it on now, so you're going to feel it go tight round your arm, okay? Right, Mr. Singh, I'm just going to take your temperature, if that's okay, just like I've done before. Okay, I'm going to pop this in your ear. You can just turn your head to the side for me, and it's just going to go in there.
Nurse, it's a bit hot in here, isn't it? Can you do something about it?
When I've done this, I'll put the fan back on for you, okay?
Okay, thank you.
Okay, that's lovely. There you go.
Is everything okay? How are you, Mr. Singh?
I'm not brilliant, but I'm okay.
His heart rate's gone up slightly. His blood pressure's come down. His urine output is starting to deteriorate, and at the moment we've got a MEWS of 4. Because we're just a bit sure of his urine output at the moment, I'm going to commence him on a fluid balance chart, if that's okay.
Okay, thanks. Well, we'll recheck his observations in an hour and keep me informed.
Will do, that's
Thanks.
okay. Okay, Mr. Singh, I'm going to go get you some more fresh water because it's important that you keep drinking plenty of fluids. If you don't, we may have to put a needle in your arm and give you some intravenous fluids. Okay. Is anybody coming in to see you later?
Yes, I think my daughter's coming in for a while.
Okay, well, I'll have a word with her when she comes in. Okay?
If observations are partially recorded or not recorded accurately, then potentially patients can deteriorate and can die. It's your interpretation of the observations that you're recording that is most important. For example, if the heart rate's up and the blood pressure's down and they're not passing much urine, then they need more fluids. And then it's the knock-on effect that has on the kidneys. So it's an underpinning knowledge that has to go with it. And then it's acting on those findings at the appropriate time and in an appropriate manner for the good outcome for the patient. It's very important to listen to patients and relatives because they know the patient better than we do. There's patients with lots of other disabilities that we need to take on board as well, and they're very much au fait with what's going on, so we do have to take on board what they're saying.
Hello, I'm back, Mr. Singh. Hello, I'm Carolyn. Are you Mr. Singh's daughter?
I am, yes. Nurse, I'm very concerned about him today. He looks very tired and lethargic.
Okay, we don't want you to worry. What I'm going to do is I'm going to get the outreach nurse to come and see him and the doctor just to give him a thorough examination.
That's fine, thank you. Thank you very much. Don't worry.
Hello, my name's Cheryl. I'm part of the critical care outreach team. I've been asked to come and see you. How's he doing?
Well, his observations have changed since this morning. First thing this morning, a MEWS of 0, and now he's gone up to a MEWS of 5.
Okay.
His temperature's actually gone up to 38. His heart rate's increased to 110. He's not actually passed urine for the last 4 hours either, so just a little bit concerned, really.
So he's deteriorated from this morning then?
Yes, yes.
Okay.
Yes.
I'm going to assess you now if that's okay. See how you're doing.
How are you, Mr. Singh? How's the patient?
He's deteriorated from this morning. He's not passed urine for about 4 hours or so. His blood pressure's down and heart rate's up, and I don't believe he's been taking much fluids, according to his daughter and his nurse. His temperature's up as well. And he looks as though he's going to need some IV access and some fluids and reassess him, hourly observations on him. And then we'll come back and see how he's doing later on.
The advantage of using recognised assessment tools are that it's a standardised way of recording observations, it's a standardised way of documentation and also communicating that we're all doing it in the same way. Well, once I conducted the assessment of the patient, I would use my information, both written and verbally, to communicate with the wider members of the multidisciplinary team. Communication is extremely important in managing a deteriorating patient, and what we're trying to do across the whole organisation is get everybody to use SAVI, which is an American communication tool originally, and it means situation, background, assessment and recommendation. So you're going through that format and you're handing over or communicating verbally either over the phone or through your care plan as well about what needs to be done and what action needs to be taken.
Right, Mr. Singh, your observations, they've all come back to normal. You're passing urine, which is good. Okay, and I've spoken to the doctor and he said you don't need to have any intravenous fluids up at the moment, but it's important that you do keep on drinking plenty of fluids.
Okay, that's good.
Okay, and we can
Thank
go
you.
back to doing your observations every 4 hours.
Okay, thank you.
Okay. And I will see you a bit later.
Thank you.
The knowledge and skills of the staff looking after the patient, that they've had adequate training and supervision, that they've been assessed as being competent in managing the actual recording observations, which we do now for all staff in the hospital. Because sometimes individuals find themselves out of the depth, and it's up to you as an individual to recognise that fact and get more senior help.